Welcome to Discover Health, a White Mountain perspective. I am your host, Dr. Tom Barela. And welcome to our show today, which is perhaps a little bit towards the home for most of you. We're going to talk about pets. We're going to talk about pets from the standpoint of the possibility of pets giving you illnesses and the possibility of you giving your pet illnesses. And to do this, we've invited our special guest today, Dr. Kelly Burke, veterinarian at the Blue Ridge Pet Clinic. And I would say welcome.
Well, thank you for having me. It's an honor.
Well, not so much of an honor, but we hope that it'll be a little bit of fun today. You know, people think of their pets as a lot of fun in the house, but those of us which are in the medical field, or you in the veterinarian field, recognize that animals get sick just like people do. And one of the things that frequently comes up is worries about people getting illnesses from their pets. You know, as a pediatrician, parents frequently came to me and asked me if there was a problem with their dog or their cat licking their little baby or their toddler, which animals considerably do. Is it really a problem?
Not that we typically see. The studies haven't really correlated between dogs licking a mouth to causing strep in humans, but it might make them a veterinarian in the future. That's what happened when I was a baby. A dog licked me straight up the face, and now I'm a veterinarian, but I didn't get sick from it.
Okay, I don't think that's going to happen most of the time when kids do that, but it is an issue for parents. So that's good to know that basically your dogs and cats are okay. But you know, we live up in the mountains and we hear about illnesses, frequently the serious illnesses that can be transferred from animals, at least up here in the mountains, because it's different than in the city where many dogs and cats are domesticated, live in a yard, or live in a house and get out very seldom. But up here, it seems like we're exposed to a lot of animals, and our pets may be exposed to a lot of animals because people go hunting and camping up here.
It really is true. We do get a lot of exposure, even in the backyard up here, of different types of animals, different species, everything. And
in your practice, do you deal a lot with the possibility that animals, pets can transmit illnesses to the family?
Luckily, those diseases don't pop up very often, but they do show up enough that I talk to people about them. But most of the time, we don't see a lot of those diseases.
Okay, and we talked a little bit about in the preparation for today about an illness that is on the forefront, at least from your standpoint, and that is?
Leptospirosis.
Okay, leptospirosis. Can you tell us a little bit about what leptospirosis is?
Well, it's a bacterial disease, and we hadn't really seen it in Arizona for the last couple of years, but this last year we've seen a couple outbreaks happen, and we've had several cases up here, so it's enough that we're starting to vaccinate for it. But it is a very serious disease that can pass between humans and dogs, and it's one of the easier diseases to pass between humans and dogs and cats. And
how is it passed usually?
So normally, humans will get it from their infected dog or cat, usually a dog, and the dog spreads it through their urine. So normally a human gets it from dealing with their dog's urine, either cleaning it up or walking around outside. And the bacteria is actually very hardy in that it can infect you even through a broken piece of skin. So if you get that liquid on you and you had a cut on your hand, it can infect you through that. It can also if you get a little sprinkled in your eyes, forbid your mouth, it can infect you through those areas as well.
Okay, well, even more important for a urine standpoint in animals is all the lakes and streams we have up here. And is that a significant possibility? I mean, to think of a whole lake full of leptospirosis really
Yeah.
Doesn't sound good.
It's not fun to think about, no, especially when we like to go swimming in the summertime.
I know that there are other illnesses. Oh,
sorry.
Don't let me stop you. Don't let me stop you about that.
We humans, we typically don't see us get infected from the water up here, mostly because we're not drinking it or getting into it that way. We typically see our dogs get infected from either the water or the urine from wildlife. So if a deer or a squirrel or mouse gets into your yard and urinates, and then your dog goes back and smells it and licks it, even just smelling it, they can get infected from that. So that's more of the concern as how your animals get it. And especially up here when we get squirrels coming through our yards all the time, coyotes, you can see even the little field mice carry this into your backyard even. So even if your dog doesn't go into the woods and goes to lakes and rivers, if they even just go outside to go to the bathroom where a squirrel might have crossed by, there is a possibility they could get infected through that.
Wow.
Yeah.
You're not safe. I was reading some statistics, some worldwide statistics on this. It obviously is a very common illness, at least on a worldwide basis. You mentioned it, it's not very common up here. Probably more common in tropical environment.
It's typically a little bit more moist, a little bit more humid environment, so other areas of the country we see more of it. Again, like I said earlier, we didn't really notice it in Arizona, but we weren't really testing for it. Because we didn't think it was a problem. But this last year or so, when we've had these outbreaks, we're now testing for it more and we're seeing more cases. So if that really means it's been on the rise, or if it's just always been there and we just didn't know about it, it's hard to say.
I know we're going to talk a little bit later along about some of the serious consequences, at least in humans, but some of the worldwide statistics indicate that about 60,000 people die every year.
It can be a very serious disease in humans. Obviously, you're the expert in the human side of things, but it can cause death, and it's the same with dogs and cats, mostly dogs again, that we see it in. And it can kill them too, and we have seen quite a few numbers of, I don't have the exact statistics, but a lot of dogs, unfortunately, do not make it through this disease because it is very serious.
So how can you tell if your dog has leptospirosis?
A lot of times it's not an easy one that we can symptom for them to come in and we can say this is leptospirosis. Many times it's the dog that doesn't want to eat anymore, is vomiting. You can see diarrhea, which obviously many things can cause that. You can see a dog that's just not normal, is just acting off. You can see some respiratory signs like sneezing, coughing cause this, and it depends on which strain and what infection as well. You can see painful muscles, so if they're in pain, that could be the start of this disease too. And so
wow.
Many different
presentations
for this disease.
Wow. I need to go back to my notes here. I'm a little bit, I mean, it really is very non-specific symptoms.
Right.
And so that may be the reasons why you don't normally test for it until there's a high index of suspicion and stuff. Exactly. And those are very similar symptoms to what happens in humans.
That's my understanding, yeah. It shows up very similarly in humans.
One of the, if you look at some of the names that leptospirosis has had through the years, 7-day fevers and harvest fever. Maybe the harvest fever comes from getting it from animals that go through the fields, like rats and mice that you were,
yeah,
and along those lines, and cane field fever.
I'm not sure about that one, but
probably the same thing.
And with harvest time, that's the time of year we typically see a rise. So in the cooler fall temperatures, that's when we see the most cases. So that would make sense that's usually harvest time is that same time.
I wonder if possibly maybe these animals, rats, field mice, rabbits, or whatever eats in the fields, are not maybe urinating on the plants. And then the plant gets transmitted to humans and stuff like that.
Especially with harvesting, you get lots of nicks and such in your hand, which that bacteria can enter through there. So makes sense.
Okay. All right. I guess they had an outgrape once at Fort Bragg. At least I was reading.
Oh, really?
About that. It's interesting if you read the legends of leptospirosis. I was reading that it may have been an epidemic in the Native American population just before the Pilgrims landed, all the way back in 1620, a long period of time. And there's another article that said that there might have been an epidemic of this from animals again in Napoleon's army in Egypt, again in the 1800s. So I guess it can be very severe, and one of this. So what else can you tell us about leptospirosis in terms of the seriousness of it? Well,
in dogs, and it's very similar in humans as far as the signs of the disease. In humans, though, they can have like a flu-type symptom, so they act like the flu, and from my understanding, this is the majority of the infected humans are just like a flu, so you get the fever, chills, that kind of thing, but you do end up passing it. I've had a couple veterinarians tell me that they've been infected with lepto, and that's their story.
Ooh.
So occasionally it can develop into something more in humans, and I'll get to that side in a second. But in dogs, what the two manifestations we typically see is either kidney failure or liver failure. We do see a pulmonary component, so a lung component, but usually it's not the major issue that we see. It's usually liver or kidney, depending on the type of bacteria. So lepto has several different strains, so several different types of it, and it depends on which type you get as to which disease process. And there's only about 4 that they've shown have caused the disease. And usually only about 4 strains cause the disease in dogs and cats, and there's hundreds of them out there, but we don't typically see them cause as much of an issue as these 4.
So very similar to strep in humans, where the beta hemolytic form is the only one that causes strep throat, and all the other ones just cause yucky disease, but not the serious side effects of strep throat, which is of course rheumatic fever. So tell me a little bit about liver disease. I mean, liver disease sounds horrible. Does it cause jaundice in dogs?
Yep, it sure does, and it does exactly like any liver failure would look like. So you can see them lose weight, you can see them vomit, you can see diarrhea, you can see yellowing of the, it's hard on the skin on dogs, they're covered.
Oh, I guess that's true.
Yeah, so you can usually see it in the whites of the eyes, in the ears, inside of the ears, depending on the coloring of the skin. And if it's really severe, you can see it in the gums. And usually by that point, though, they've been having a lot of other disease signs, and hopefully they've been to a veterinarian before they get to that point.
They get that. And kidney failure in dogs is probably similar to humans?
Very similar. Actually, I have one in clinic right now that I'm suspicious of lepto. We haven't got the confirmation yet, but it showed up with kidney failure, and that is drinking a lot, urinating a lot. He was very lethargic, meaning he didn't have much activity going on for the last couple days, and vomiting and diarrhea. Still wanting to eat a little bit, but would vomit it right back up.
So a lot of symptoms, and you say you don't normally see the lung manifestations of it. You know, that's almost identical to the wild WEIL syndrome that we see in humans when the lepto is not picked up. You know, the jaundice, the kidney disease, typical of bacterial infections, but also the lung disease, which in humans is one of the very few causes of bleeding in the lungs itself. I suspect that that's also part of the very, very serious.
It usually is, but again, we typically see the liver and kidney kill the animal before the lung.
So
we do see on almost 70–80% of the animals that they have some sort of lung issue on x-ray, but we don't see it where it actually manifests itself and causes a problem.
No, so the liver and the kidneys are and those are the 2 filters of the body.
Exactly.
So let's go a little further with this. What's prevention?
Right. So luckily, in dogs, we have a vaccination for leptospirosis. And there was one several years ago, about 10, 15, 20 years ago, that came out on the market. And it was a 2 serovar, meaning a 2-strain vaccine. And we saw a lot of reactions to it as far as vaccine reactions. So they'd be really, really painful, swelling, anaphylaxis, those kind of issues.
Anaphylaxis being the severe allergic response.
Right. So they would die from it. So they kind of took that off the market in places that were not high risk area. We didn't see that as a risk for the vaccine, for the side effects of that. But now they've kind of revamped it and come out with a 4 serovar, which is the 4 different strains, the ones that cause the most disease. And we don't see the side effects like we did with that old vaccine. It's now at the same risk as any other vaccine we see, which are very, very low as far as risks associated.
For side effects.
Yeah, for side effects as far as the vaccine goes. So now we are starting to vaccinate for it. And we didn't in Arizona because we didn't think we're a high-risk area, but this last year in 2017, the state veterinarian came out and wants everyone to vaccinate for it at this point, even if you're in city.
Okay, city.
City.
We are in a town.
So a city, because of the rats and that kind of thing that can spread it. There is a chance. When they first came the disease process, we saw hunting dogs and dogs that were out in the wild be the ones that came up with the disease. And then we vaccinated those dogs. Now we're seeing more city dogs come up with the disease because they haven't been vaccinated like these other hunting dogs. And then these animals that have adapted into city life, like the coyotes and mice and that kind of thing in the city, they've spread it through that into their backyards, and now these city dogs are getting it. So now we're vaccinating those as well.
And so obviously this is maybe regional in the country, so that if dog owners, what do you call it?
It depends on
master?
where you're at.
but if you're traveling, there may be risk in other parts of the country. If you say definitely. Wet areas, that might be the South, Florida.
Mm-hmm. The Southeast usually is our big ticket for a lot of infectious diseases. It's kind of a little cesspool over there, but
I hope nobody from that part of the country is watching this morning, but it's true.
It has an environment that breeds infectious disease, but so traveling dogs, we typically recommend get the vaccine too, just to make sure to be safe.
Make sure. I think that's important. So let's talk about treatment.
Mm-hmm. So it really depends, again, on what type manifestation of the disease, so liver or kidney disease. And usually it depends on the strain. So 2 of the 4 strains I told you in the vaccine cause kidney and 2 cause liver failure. We don't typically see them together.
Oh, okay.
And for example, the one that we are doing right now in the clinic, it is really fluid support. And so getting aggressive fluid therapy, because most of these dogs come in very dehydrated. Even though they've been drinking a lot of water, they haven't been able to maintain it, either through vomiting or diarrhea or from kidney loss. And so we have to aggressively give them fluids to correct that dehydration. And then we give them antibiotic treatment to fix that infection and kill it.
Because it's a bacterial infection, it responds to antibiotics?
Yep, it sure does. And luckily, it's not a very resistant bacteria. We don't see a lot of resistance to it. And so we typically start off with injectable antibiotics because the animals aren't eating.
Good point.
And then we switch to orals at home, so that way they don't spread to the humans.
I suspect also a big part of this is recognizing early on that your animal is sick.
Yes, exactly. And so it helps out a lot on our end if you bring your animal who is showing any of those signs, which is, again, hard because those are a lot of signs that can cause this disease. But bringing them in early and getting tested early definitely helps in the long run and in the expense of the treatment.
So if an animal, let's say, gets some kind of a virus or stomach thing, just a regular one that isn't going to cause horrible stuff like this, what is a reasonable time to kind of just watch your dog and stuff like that, because we don't want everybody running into your clinic thinking they have leptospirosis in their animal. So I mean, there's some practical advice to families and I don't even caretakers or
typically what I tell people, especially with vomiting and diarrhea, because those are the big diseases or big symptoms we see with these dogs, is to come in if it's been longer than 24 hours. If the dog is not eating, should come in sooner. If they're not drinking, come in sooner than that. But if they've been off, really lethargic, or vomiting every hour a lot, then definitely bring them in sooner. But usually if they're just vomiting every so often, attitude is still pretty good, they're still semi-interested in food, a day or two is probably going to be okay. But for example, the dog I have in clinic right now, it's been 2 days and he already had signs of kidney failure. So those are, it can happen very quickly.
That is a very short incubation period. Wow.
I'd rather see a dog and have a negative and have them come in too soon rather than come in too late.
Well, that's always the safety factor of all of us that treat illness. Interesting illness, possibilities very wide, possibilities up here on the mountain. But I want us to take a couple minutes here as we finish up here, talking about some other illnesses that you can get from your pets. And I wanted to start with ringworm. Typically, parents come in with their kids, or adults come in, and they've got ringworm, a place, and they always seem to ask, could I have gotten this from my dog, cat, rat, and stuff? And is this, how do you tell whether your animal has ringworm or not?
Well, it's a tricky situation, but I've had this question many times. I've actually had dogs and cats come in and they've stated their child has ringworm, and so they want their animal checked out. The safest thing, again, is just always bringing them in to get checked out. But usually in dogs and cats, dogs especially, if they have a ringworm infection, they're going to have a rash of some sort. Now, how it looks, you don't typically see that circular round pattern that is typical for humans. It can happen, but ringworm can really look like anything in dogs as far as rashes go. And so if you see a rash, bring them in, and the ideal testing is we culture to see if it does grow back ringworm. In cats, they can carry ringworm without having any disease process. So usually what we can do is, again, culture your cat. So what I mean by that is we take some hairs from the cat and put it in the media and see if it grows any ringworm. And if it does, we can treat them for it.
Cool. All right. I know that parents see animals with mange, where their skin is really scaled and stuff like that. Is that a risk for people?
It depends on the type of mange. There is one that you can see that has no risk to people, and there is one that can be infectious to people, but it doesn't like humans. It prefers animals. So if it does get on humans, it usually doesn't last very long. And usually what you would see would be a little rash show up on you if you did have that issue. But I can say I've treated many mange animals and I've never gotten it.
Now, mange is caused by?
Mites.
Mites.
Yes.
So, one of the mite illnesses for humans is scabies.
Yes.
Any relation to animals?
There is a scabies in humans, and that's the one I was referring to, can be infectious to humans.
Ah, okay. All right.
It's a different species of mite, of the scabies mite. Sarcoptes is the family name.
All right.
But again, it can pass to humans, and you can occasionally get that infection of the dog mite. But usually it likes to go back to the dog.
Okay, but so it is possible that you get scabies from your dog. Mm-hmm. And scabies, of course, looks like little baby mosquito bites with scabs on it. Okay, cool.
But if your dog doesn't have any signs of it, it doesn't have it.
It doesn't have it. Okay, so they got to be sick with it at the time. Okay, right. And that makes a lot of sense. All right, how about Giardia? Big problem.
In humans and dogs, yes, it's a huge problem. But if you look at the CDC, the Giardia species that causes disease in dogs and cats, usually it's dogs again, doesn't cause disease in humans. They don't notice any infection from that.
So all these episodes of Giardia infections at Slide Rock over in Sedona.
Those are from other people. Yeah.
Oh, I can't blame my animals swimming in it. All right, and I want to finish with one thing, and that is cat scratch fever. Mm-hmm. We always, humans, we see people with swollen lymph nodes in their necks or their arms and stuff like that, and we always ask, "Do you have a cat?" I know you can get it from cats, but do cats have to be sick with it at the same time, or is it
not
just...
necessarily? They can give you that, but again, cats, if they scratch you, can give you all sorts of different bacteria. So if it's deep, I always recommend either getting it checked out or washing your hands. But they don't necessarily have to be sick with the bacteria that causes cat scratch fever.
Okay, all right, that's important. I know that dog and cat bites are something we worry about treating because they do have a species in their mouths that can be very infectious to people, but we won't worry about that. And I guess we could talk about plague and we could talk about rabies, but that's really not a common thing.
And they're really, really easy to prevent. Rabies with the vaccination, and plague, getting a good flea tick preventative is the best.
Oh, what great advice. What great advice. Those flea tick collars work?
Actually, no. The flea tick collars I do not recommend. They work great for the top half of the body, but not the bottom. So what I recommend is a chewable or topical.
Wow, great. What an interesting perspective, and I do thank you for your comments today. And those of you that are watching in, we have finished with Dr. Burke, a veterinarian who's given us some very good advice for animals on leptospirosis and some of the other diseases. And take her advice, and if you find problems with your animal, go see a veterinarian. And thank you for watching. This is your host, Dr. Tom Barela. Have a great day.